Thanks so much, Georgette, and thank you all for joining us today. I'm so honored to be speaking with each and every one of you, even if it's remotely. My name is Kristan Hawkins. I'm the president of Students for Life and Students for Life Action and podcast host of Explicitly Pro Life podcast. I hope you've tuned in so far. So, today I've been asked to speak to you about some critical facts that you need to know about abortion. And hopefully, when you learn these facts, they will prompt you to step up your game and join us in the pro-life movement to do more than you've ever done before, especially in this year of 2021, to join us on the front lines in the pro-life generation, saving lives, serving women. So number one, no single disease, no event, war takes more human life every single year than the violence of abortion. And this is just plain fact. Since 1973, when the Roe v. Wade and Doe v. Bolton, the two Supreme Court decisions that were handed down, more than 54 million babies have been aborted in the United States. In 2017, the last reported year, we know over 862,000 abortions were committed. In fact, I believe this number is actually larger than that, but the United States doesn't have a national abortion reporting law. So we actually have to rely on the abortion industry to self-report their own numbers. And some states don't even report those numbers. So it's probably around 1 million abortions happen every year. Today, while we're watching this, while we're tuning in, more than 2,300 children will be aborted. About 900 of those 2,300 children will be killed inside of Planned Parenthood facilities across the nation. Planned Parenthood is the nation's largest abortion vendor. They receive almost $600 million of taxpayer funds every single year, and they're angling for a lot more this year. About 46% of all abortions are committed on women under 25. So about 12% until the age of 20, and then women 20 to 24 account for about 34% of all abortions. Some estimates say 1 in 4 American women, every 1 in 4 American women will have at least one abortion by the age of 45. No matter what you may like to think, or no matter what your friends who are kind of uncomfortable with abortion but say it still should be legal, abortion is not rare. It happens 2,300 times every single day. Fact 2. Abortion is a social justice issue. It directly affects minority and low-income communities and neighborhoods, because that's where the abortion industry targets. Planned Parenthood, the nation's largest abortion vendor, was founded by an avowed racist, a eugenicist, Margaret Sanger, who she and her other founding board members believed that we needed to limit the number of people who were allowed to freely reproduce, that certain types of people, based on their education, their income level, based on their skin color, they shouldn't be allowed to just freely reproduce, that they should be encouraged through sterilization or through chemical contraception to dramatically lower the number of children that they could create. They founded Planned Parenthood. In fact, it was called the American Birth Control League, that then later became known as Planned Parenthood. Today, Planned Parenthood continues to live out this legacy that Margaret Sanger set out for its organization. The vast majority of Planned Parenthood facilities are in low-income minority neighborhoods. Over 80%. Over 80%. These walkable minority neighborhoods are right where the abortion industry targets. In fact, when they're trying to figure out where to put a new abortion industry, they're going to look 2 places: minority neighborhoods and college campuses. In some cities like New York City, more Black children are aborted every year, every day, than are actually born. Black women make up 13% of the U.S. population, yet account for 38% of all abortions. These statistics should make it very clear to you that Planned Parenthood is still fulfilling Margaret Sanger's dream for her organization. Despite all the Black Lives Matter, posters they can put up on their buildings, all the rhetoric they can use, Planned Parenthood was founded by a racist and continues to carry out that racist legacy. And we fund them with our taxpayer dollars. Outraged yet? I am. Fact 3. Abortion betrays women. I know a lot of times when we talk about abortion, we kind of quickly talk about how abortion hurts women and we focus on the child, which is I think important, because at the end of the day, no matter what argument gets thrown at you for supporting abortion, the fundamental question you always have to ask, whoever you're having a dialogue with about abortion, is what is it, right? That's always the fundamental question. But I think it's very, very important for us as pro-life advocates to talk about how abortion harms women psychologically, emotionally, and physically. Abortion does not set women free. It's not the empowerment of women like they say it is. In fact, it's actually the opposite. It's a distortion of feminism. Because abortion says that women are only equal to men, unless they have access to a special surgery. That women have to have this access to a special surgery. And when that happens, then they can be equal to men. That's what abortion does. You don't have to spend a lot of time researching how abortion hurts women, but I encourage you, go to PubMed, go to the National Institutes of Health website. You can type in the word abortion. You'll get all of these medical, peer-reviewed medical journal articles studying abortion. Many of the studies that are being done abroad, not being done in America, because as you can tell, if you haven't been able to tell, you'll start seeing now, there's clearly a bias in many medical schools in favor of abortion here in the United States. But there's so many articles, well-researched articles out there showing how abortion hurts women. There's numerous studies that have said there's an increased risk for suicide. In fact, researchers in Finland did a statistical association between women who had a child, than women who had a miscarriage, women who had an abortion. And it was 11.3 per 100,000 women was the normal rate of suicide in Finland for women. Following an abortion, it was 3 times higher. It was 39.7%. It was actually 6 times lower for women after they've given birth to a child. Over 20 studies have linked abortion to increased rates of drug and alcohol abuse. A meta-analysis of 15 years of published research in the British Journal of Psychiatry, not a pro-life medical journal by any stretch of the imagination, found that women who had undergone an abortion experienced 81% increased risk of mental health problems. 34% more likely to develop anxiety disorders, 37% more likely to have depression, 81% increased risk. That's unbelievable. Then when you set aside the mental and emotional consequences of abortion, how abortion betrays women, then we start getting into some of the physical side effects of abortion. A landmark article in Obstetrical and Gynecological Survey compiled the results of several studies on abortion. This was another meta-analysis. These showed an induced abortion increased the risk of placenta previa in later pregnancies by 50% and doubled the risk of preterm birth. Placenta previa, extremely dangerous for both mother and child. Cancer Causes Control 2014 journal concluded that just one abortion increased the risk of breast cancer by 44%. This was another meta-analysis. It was a Chinese meta-analysis of 26 studies covering 14 provinces. Then to move on beyond just the risks of the women face mentally, then we get into the physical risk. I mean, I talked a little bit about some of the research journals. I mean, you can look. I mean, every year there are stories that pop up of women who die from legal abortion in the United States of America. Legalizing abortion didn't make it less risky for women. Did not. In fact, if you think about it, abortion wasn't legal, then Roe and Doe was handed down, then suddenly it was legal. There wasn't like this national abortion training regimen. The people who were committing abortions before Roe versus Wade simply began to advertise their abortions after Roe versus Wade. We often hear the argument of, well, I don't like abortion, but I don't want women dying from back alley abortions, therefore it should be legal. But ask yourself who was doing abortions before Roe versus Wade, ask yourself who is doing them after, because it's the exact same people. And the numbers you often hear cited as, all women were dying by tens of thousands, that actually wasn't true. In fact, Christopher Tietz, Planned Parenthood's own acclaimed statistician, who won their highest honor in 1973, actually admitted in the 50s and then again in the 60s that the number of women who are dying from illegal abortions that number was around 500 a year. Maybe we get up to 1,000, but never over 1,000. So those numbers that you often hear as a justification for why abortion should be legal are just wrong. But getting beyond just physical and emotional, we can also talk about how dangerous abortion facilities actually are because they're unregulated in our nation. It's unbelievable. We call this a women's right, but then there's absolutely no, because it's abortion, no one wants to talk about. So women's health care is healthcare isn't regulated. So a hair salon, your pet's veterinarian office, there are certain regulations, protocols, safety, health standards that have to be followed. There are more regulations in a women's hair care salon than there are for abortion facilities across the country, and it shows. In 2017, a pro-life organization, Americans United for Life, released a report where they had FOIA requests, Freedom of Information requests, health inspection records from several states. They were able to research 30 states. They used an 8-year window from 2008 to 2016. In that time, just in what that was given to them, they found 1,400 health and safety violations from 227 facilities. The top 10 violations they found, 130 abortion facilities in 22 states failed to ensure a safe and sanitary environment for their abortions. 100 of facilities in 17 states failed to accurately document patient records and keep patient medical information confidential. 82 abortion facilities in 14 states failed to ensure staff were properly trained for duties. And it goes on and on and on. Abortion is never safe for a child, certainly. And it's not safe for the mother either. It betrays women. It betrays women because it tells her she can't. She's less than, that she's not strong enough, and that she has to risk her life and end the life of her child in order to live out her career goals, her education goals. We know that's a farce, and that she can do both, and she can choose both. Fact number 4. Abortion laws differ state by state. Sometimes when you're talking about abortion with friends and family, people will actually remark, and I find it fascinating people try to do this, considering this is what I do for a living, but they try to argue this with me. My cousin does this to me all the time on Facebook. They try to argue that abortion isn't legal in all 9 months of pregnancy, when really it is. Roe versus Wade legalized abortion in the first 3 months. Doe versus Bolton, the companion case, which was handed down the same day as Roe v. Wade, legalized abortion up until the moment of birth, using a loose definition of a woman's health, meaning if she's emotionally distressed because of the pregnancy, therefore the abortion is allowed because it affects a woman's health. Some states have prohibited abortions. They'll cap abortion so you can't obtain an abortion after a child feels excruciating pain, 20 weeks. Or you can't have an abortion after 24 weeks. Other states, that's not the case. Nebraska, Maryland, Nebraska and Maryland, Colorado, New Mexico. I can keep going. There are a number of states where you can actually obtain a birthday abortion, a due date abortion. In fact, there are abortionists who will do abortions up until 36 weeks and will advertise that fact. This is why it's so important to be involved in your state legislature and to know who's making your laws at your state capitol. Because there's so many laws that differ state by state. In fact, the majority of abortion restrictions that have been passed in the last 10, 15 years have all been passed at the state level. I mean, I shouldn't come as a surprise to anyone. Washington, D.C. is broken. Nothing really happens. But the state level is where we determine our abortion laws. So it's crucial that you pay attention to what you're funding and your tax dollars. For example, federally right now, we have the Hyde Amendment for now that says that federal taxpayer dollars can't fund abortion. But states can. So in some states, they actually, even though the federal health care money, Medicaid money can't fund abortions, the state Medicaid money can fund abortions, like Illinois and California. Pay attention to what happens in your state capital because it matters when it comes to abortion. Fact 5. Chemical abortion is the fastest form of abortion, growing form of abortion in the United States. It's extremely dangerous. In fact, the abortion lobby has been using the COVID crisis to push forward this type of abortion. Why do they love this type of abortion? Because it's easier for them. They don't have to dispose of the body. In 2015, researchers at the Center for Medical Progress went undercover and released tapes showing Planned Parenthood and other abortion facility workers haggling over the price of body parts of babies they aborted. Because this happens every day in the abortion industry. They sell the body parts of children they abort to medical researchers. This was proven. Undoubtedly. You can watch the videos. One of the reasons why the abortion industry likes it is because a woman's paying them to end the life of their child, and then they get more money for selling the baby's body parts. They also like it because they don't have to worry about the disposal of the children. Disposing of the children is very difficult for them. It's ghastly work. No one wants to get rid of all the bodies of children. So the abortion industry likes chemical abortions because a woman's told, take these pills, sit on the toilet, keep flushing, and don't look. It's less staff time. It's easier to convince abortionists to be abortionists because all they're doing is prescribing a pill and then a couple weeks later checking the contents of the uterus to make sure it's been emptied. So it's easier for them to convince more doctors to become abortionists, there is a national shortage of abortion workers, they call it. During the COVID pandemic, the abortion industry has been using these pills to do telemed abortions, to prescribe these chemical abortion pills to women via webcam, just like how I'm coming to you today, without any physical exam. So sometimes when you hear that old adage of abortion should be between a woman or a doctor, yeah, it's like a woman and her webcam. And what's really scary is in an abortion, a woman has to be tested before her abortion to see if her blood type is Rh negative. If she's Rh negative, just like if she was pregnant, she has to get Rogaine shots. These shots, what will happen is they prevent her body's antibodies from attacking future pregnancies. Because if you are Rh negative and you go through one pregnancy, whether that pregnancy ends in miscarriage, abortion, or live birth, if you do not get this shot, you are not able to carry to term other children. Your body will literally attack the cells of the child. With these types of chemical abortions, they're not even asking women to confirm she's pregnant, 1, because it's over webcam, 2, and get a blood test to make sure she's Rh negative. These chemical abortion pills have 4 times the amount of complications as surgical abortions. Numerous side effects. And a large percentage, between 5 to 15%, actually don't complete at home, meaning she still has to go into an abortion facility for a traditional D&C surgical abortion procedure to empty out the lining, the uterine contents. These are deadly. On college campuses, like in California, they've demanded that college campuses now dispense these pills everywhere. that campus health centers have to give them out, turning every single state university campus in California into an abortion facility. Now, I've given you 5 facts about abortion, and I have to go. I know Georgette's going to say I'm running late. But I want to give you an additional fact, one that you might have not heard of yet. It's a fact that abortion only continues in our country because the Christians allow it to continue. We tolerate this. There's Christians who work in abortion facilities, who commit abortions. The majority of women who seek an abortion admit that they're a Christian and have gone to church recently. It's time for us to stand up and to no longer tolerate abortion. Because if the Christian church would stand up against abortion and the abortion industry, the predatory abortion industry, we could end the atrocity of abortion. We could end the violence of abortion. We could provide real help to women in crisis. Now, what can you do? Talk to your kids about abortion. Talk to them about moral absolutes. There's right and wrong. Trust me, moral relativism is for someone who works on college campuses and high school campuses. It's the most dangerous thing we face. There's right and wrong. And some things are wrong. Ending the life of a human being is always wrong. If you know a young person, have them start a Students for Life group in their middle school, high school, college campus. We can help them. All you have to do is email your state name at studentsforlife.org, and you'll be connected to one of our staffers. Your state name at studentsforlife.org. Super easy. Host us. Host Students for Life. Host another pro-life group at your church and your youth group. Get a conversation started in your church about abortion. I think this is one of the biggest things I worry about the most. We did a study a couple years ago asking Protestant pastors across the country, do you have a pro-life ministry in church? Do you talk about abortion? Only 6% of Protestant pastors we surveyed said they had a pro-life ministry in their church. This is why abortion continues, because our church doesn't rise up to stop it. Talk about abortion in your church. Bring Project Rachel. Bring Rachel's Vineyard. Bring in post-abortion healing retreats. Bring in Saturday No More awareness into your church to offer hope and healing to women suffering, women and men suffering the consequences of an abortion decision. Bring in Embrace Grace, a pregnancy center, other ministries into your church to help women facing a crisis pregnancy. Bring in Students for Life and other groups to talk to your youth group about abortion. You can do this. I'm counting on you. I'm counting on us, the church, to finally rise up. 2020 is going to be a difficult year. I know we all hope all the bad stuff was left behind in 2020, but I hate to be the bearer of bad news, but I think 2021 is going to be extremely difficult. In fact, the next 4 years is going to be extremely difficult for the entire pro-life movement, for anyone who advocates against the violence of abortion. So we need you. We need you to join us. Will you?